Yes, ma'am.
We're talking a little bit about imposter syndrome at this point.
Yes.
Okay. You're familiar with that phrase, right?
Yes.
Okay,
I am
cool.
familiar with imposter syndrome.
So, how do you, as an experienced orthopedic surgeon, deal with imposter syndrome, and have you ever experienced it?
So I would say it's much more common to early in my career to be dealing with imposter syndrome or that feeling like I didn't belong, right? And I think there's a piece of what we're doing, obviously, when you're training, where you're elevating yourself, you're getting better, you're improving, you're striving for that level of excellence. And I think that it's normal to have that feeling like, man, should I be in the room? But everybody had to do their first shoulder replacement. Everybody had to do their first knee replacement. Everybody had to do their first ACL on their own. And I think that one of the ways that you can combat that compartment syndrome is you can break things down into smaller parts, right? If there's 250 steps in a case, it can be a little bit overwhelming when you're starting. But, certainly understanding that I know how the tools work. I know how to get things set where I need to be. I know what the balance is supposed to be. I know where I'm supposed to be, because you can get that feeling the first time in the operating room, like, man, all eyes are on me. The decisions are on me. The timing is on me. And I think that that's a feeling of imposter syndrome that's, whether surgeons admit it or not, it's common. It's common especially early, especially when you're doing things that you've never done before. Not never done before, but never done on your own, where you're the ultimate say, right?
Gotcha.
So I think that dealing with that it takes a lot of humility to be able to be there, to recognize it. But then I think that the way that surgeons do it, which could translate outside of medicine as well, is you just try to break down the process into pieces that that's you're no longer an imposter in the world of putting in a screw.
Sure.